advance healthcare and create vitality and enthusiasm in healing. We are here for you when you need us, offering a comprehensive range of inpatient, outpatient, and emergency care services. .833 KSJE, you're listening to the Scott Michlin Morning Program. We're taking a look for folks who are watching us on our YouTube channel this morning and later on our Facebook page, the morning time-lapse video from our camera on our tower here at San Juan College. You can see the college in the dark, and suddenly the sun comes up and there you are. Forecast, though, we are expecting another cloudy day today as we start our week. Today's high in Farmington, 56 degrees with scattered showers and maybe some thunderstorms this afternoon. Still more chances for rain overnight tonight with a low of 41, 55 for a high tomorrow. And again, maybe some more sunshine coming in on Wednesday and Thursday with mostly sunny conditions. Still cooler, though, 61 for a high Wednesday, 60 on Thursday, and overnight lows in the mid to lower 40s. I'm Scott Michlin, again our guest this morning from the San Juan County Partnership. We are talking with Pamela Drake and Debbie Frank about the upcoming San Juan County's Got Talent show on October 20th. Again, both of you, thank you for being here.
Thank you very much.
You bet. It's good to have you here in the studio to talk about all the things the partnership does. And one thing was just in the newspaper last week. The partnership was a part of this grant that has come to San Juan College. It's all about food security and some other issues relating with locally grown food, right?
Right. So San Juan County Partnership has a grant with the Department of Health to increase healthy food options for children in schools and in the community,
right,
and also to increase exercise options for both those venues
nice.
As well. And so we helped to partner with the college to obtain that food hub grant. So we're really happy that that is happening.
And regular viewers and listeners of this program might remember guest Patience Williams, who was here not too long ago talking about some of these issues that we're discussing this morning.
Yeah.
And so this is another way how the community works well together with the college and the partnership and other players kind of working for the greater good of getting this grant and kind of promoting these programs.
San Juan County has always been known statewide for its cooperation amongst the entities within the county, and I'm happy to say that that continues. And so San Juan County Partnership is a community coalition, and we have meetings in conjunction with the Community Health Improvement Council that are held every third Thursday of the month at 3 o'clock at the downtown center. So that coalition, that grouping of people getting together to talk about what the community issues are, how we can address them, and also to say, well, you know, I do this and you do that, so how can we work together to do that? And I think getting this Food Hub grant and some of the other things that have been going on in the community around nutrition really demonstrate that. They've increase the interest in the growers' markets and all kinds of wonderful things in those areas.
Right. And do you think that may have played a role in getting this grant? Is our ability to work together, or I don't know what the application asked about, but it seems like that would be a plus rather than a minus to see how well we play together with each other.
I would hope so, and like you, I don't know what the grant asks for either.
Right.
But generally, you know, I know that the grants that we apply for always ask, who are your collaborators? How do you work together with people?
Track record, things like that.
Right. Right.
And they always ask for data, I know, too, right, to follow up with, to see how,
do.
What did you do with our money, how did it make an impact, those kinds of things, which I'm sure this one probably asks about as well. So.
The accountability is really, has really increased over the years, and Debbie knows that very well with the work that she does. She's our office manager and bookkeeper, and so a lot of the reporting falls on her shoulders, and it's pretty intense.
A lot more follow-up now than there used to be, probably, huh?
There is, and a lot more backup documentation and just for the invoicing, yeah.
Sure.
It's a good thing, I mean, basically it's a good thing because as taxpayers, we want to know that that grant money is being spent properly and that it's not, nobody's going to Hawaii with the grant money and nobody's going to Hawaii with the grant money.
Right.
Most people aren't even going to Albuquerque or
Right.
Santa Fe with grant money. That's how it's become a lot more accountable.
Sure.
Yeah.
But this is very exciting because this really talks about, again, nutrition and better nutrition for area residents. And we
Right.
hear a lot about, and I think for folks maybe who live in the 4 now cities in Farmington, Aztec, Bloomfield, and Kirtland maybe don't think about this, but if you don't live in one of those areas, you live maybe 30 miles or more from a grocery store or a place where you can get fresh fruits and vegetables and things like that. It's a big problem for people in our county and also people around the country, too.
It is, and we're hoping to make a little niche in that and
Sure.
make some changes so that people have more access that way.
Right. And as Patience and I have talked about, too, trying to get maybe the growers to increase their growing so that there's more food available, more locally grown food available for big organizations like the school districts, the hospital, the college perhaps, to maybe be able to buy some of this locally grown fruits and vegetables that
Schools.
taste better and work better and last longer and all these things.
Well, and local fresh food is the best that you can do. If you buy it at the grocery store, you don't know how long it's been. I think they try really hard to keep it fresh, but if you can buy it down the street from somebody who grew it, that's a lot better.
Picked this morning, not last week.
Right.
It might be a better thing.
Right.
So anyway, congratulations. That's
Thank
a great
you.
thing.
Oh, thank you. Congratulations to the college
Right.
because really they're the main ones on it, so that's great.
Very exciting.
May I mention Take Back Day?
You may.
So every 6 months, nationally, the Drug Enforcement Agency, DEA, hosts a Take Back Day where people can take back their expired or unused prescription drugs to extra locations. There are always permanent locations that people can take them to in our communities. But on October 27th, there are going to be extra locations. It's a Saturday between 10 and 1. And they will be able to take them back and dispose of them properly. That's the best way to get rid of extra prescription drugs that you have in your locked cabinet.
In your hopefully your locked cabinet, right?
Hopefully locked cabinet.
Sure. And this is a big issue around the country, I know, of folks maybe inadvertently not having their prescription drugs in a locked cabinet and others getting a hold of them and abusing them, having a problem with them or what have you, can
Right.
causes big problems for folks.
Right. You don't want people to, well, I think, first and foremost is we should never share our prescription drugs. Because they were prescribed to you specifically, knowing your background and your history and your medical condition, and so people should never share with somebody else in the family, friends, whatever, and then people actually taking them in order to get high or sell them to someone else. It is a problem, and it can lead to other bigger problems, addiction, overdose, that can actually result in death. So those are really important and serious things that people need to pay attention to. And as we say, lock up your medications. And if you don't have a place to lock it, keep it in a place where you can keep an eye on it all the time. So, don't
Which
put
doesn't
it,
mean the bathroom, probably.
It doesn't mean the bathroom.
Right.
It doesn't mean the medicine cabinet in the bathroom. Generally, in a well-traveled place.
Kitchen cabinet, maybe.
Kitchen
even.
cabinet
Yeah.
where you can watch it. Also keeping an inventory of your medication so that you know exactly how many pills, tablets should be in the bottle at all times. So we have little guidebooks that
Yeah.
we can give to people that talk about all those issues and how to dispose of things if they can't take them to Take Back Day, why you shouldn't share, give some statistics and do's and don'ts and things like that people can get from the partnership, and we actively distribute those to primarily parents at this point.
Sure.
You know, we want parents to understand the severity of the problem and that they can certainly have an effect on it.
That makes sense. And of course, it's always important too that if a drug has expired, if the prescription was good for 30 days and you've had it in your locked cabinet for 2 months, it's probably a good idea to get rid of it because it may not be effective to do what it was prescribed to do, and you don't need it anymore.
Exactly. The expiration date is there for a reason.
Yeah.
So when it expires, you really do need to get rid of it.
Very true.
So.
Well, good point. Again, that's coming up on October 27th.
Yes.
A week after the big San Juan County's Got
Yes,
Talent show.
Exactly. A week.
And again, as you mentioned, there are additional drop-off locations throughout the county. So, and folks can find out more, I know, on probably your Facebook page for the partnership and other places.
Right. And I can mention those.
Please do.
All
Sure.
right. There are both Walgreens in Farmington
Okay.
are take-back places. Farmers in Bloomfield, Safeway in Aztec, and also the Shiprock Police Department is going to be a place as well. I think that's all. I think that's all for the extra locations.
Right.
And so those take-back places are monitored by someone, law enforcement in general, so that, you know, nobody gets into them or
Sure.
whatever. And so the permanent locations, if you can't take them back on October 27th, are at all the police departments in the county. Well, all the ones on this side of the county. So Farmington, Bloomfield, Aztec police departments all have them. The sheriff's office, 2 of the sheriff's substations have it. And then you can also return them at Northern Navajo Medical Center.
Okay.
And that's on a permanent basis. So
Good.
Anytime.
Well, that does cover most of the county then, at least the northern half, I would say. And if folks have a reason to come into town, that would be a great thing to just drop off and get rid of those things and not have to worry about it anymore.
Right.
So, and do it the right way, which is so very important. So,
Right.
thank you for mentioning that. And that is just one of the things that the partnership does to keep us all healthier and safer and things like that. You have a lot of programs, I know, with in the schools, and you work with the school districts and things like that.
One of the things that I always like to mention is that we have a youth coalition. So we do that in conjunction with Farmington Library. They have a Mayor's Teen Advisory Council.
Right.
And so we have kind of 2 parts to it. There's the Mayor's Teen Advisory Council and then the Youth Coalition. And that coalition addresses underage drinking prevention. And we just had a sticker shock activity recently where we go into the retail outlets and put stickers on the cases of alcohol that remind people that it's a 4th-degree felony to provide alcohol to minors. That's not a good thing to get
Right.
a 4th-degree felony.
No.
It's really pretty bad. So we like to remind people that's a nationally proven strategy, that if you do that frequently, you can actually lower the underage drinking rate. So that being said, we're going to do another one on October 25th for prior to Halloween. And the Youth Coalition, they're the ones who tell us when we ought to do them.
Oh, good.
And
Okay.
I was talking about doing it between Thanksgiving and Christmas or right before Thanksgiving, and they said, we need to do one for Halloween. And I said, really? And they're like, yeah, definitely do one for
Interesting.
Halloween.
Okay.
So we're going to do that, and anybody's welcome. Any youth is welcome to come to that. Countywide, it isn't just for Farmington.
Right.
So people can come to that, and
And this is only possible because the stores allow you to go in and do this. So again, it's another community partnership and collaboration to allow
Right.
these volunteers in to mark up and put the stickers on their
Right.
alcohol.
Right, and I should say that our last sticker shock was at Smith's, and the next one we're hoping to have at the East Main Safeway store. So that'll be fun, and we have the youth come to place the stickers, but we also have adults there to actually move the cases because they can't handle the
Right.
alcohol at all.
Yeah.
So it's a really good thing. People have a good time. We had a new, one of our college interns came and helped, and she said, when are you going to do another one? That was really fun to do. And, you know, you really feel like you're doing something that's visible in the community and that really helps the community.
Right. And that's important, I think, to remind all of us about what's going on in our community. If you're not witnessing it firsthand, a reminder that, you know, adults are buying alcohol for kids, and we need to remind them not to do that.
It does happen.
And right, even in our fair city. We don't want that to happen. So
Even in our fair county.
that's true. That's very true. And you also do a lot of surveys, I think, too, with young people to kind of learn about what the latest trends are, what's going on in their world. Because sometimes us grown-ups are a little out of touch.
We do yearly surveys, so through our Dene Bahojo Coalition, which is in Shiprock, we do a Communities That Care survey, and that's actually, I think, going on right about now. And we ask the young people what they think and what they're doing, and so we have up-to-date current information. We also rely on the state survey that Department of Health and Department of Education, PED, do the Youth Risk and Resiliency Survey. That's done every other year. So we just recently have received the results from the 2017 survey. So we know, and that covers more than just alcohol usage and things like that. It covers a wide range, bullying, safety at school, safety at home, sexual activity, all those things. It really covers a wide range of topics with the young people. And we do that, and then we also do a community survey to find out, you know, like how many people have misused prescription medications?
Right.
How many people have shared those medications? And we do that every year as well. So we really try to cover it and make sure that we're addressing the things that need to be addressed. And remember I mentioned sharing, not sharing. That's something that we came up more in our last survey, that people are actually sharing more than they should, or that rate is higher than we'd like to see it. So we're going to emphasize that this year. So that's how we use the surveys to help us know what work to actually do.
Sure. Well, you can see trends, I think, and focus in on maybe what's happening, what's trending to happen, what's continuing to happen, things like that. And I think it's really important to get local data, because a lot of times for our state, we kind of get clumped into the larger cities and just assume that whatever's happening in there is happening statewide, and that may or may not be the case. So that local data is really important.
Right. Yeah, when we first hear the results of the Youth Risk and Resiliency Survey, and the first results that come out are the statewide results, and I'm always, okay, that's fine, but what about San Juan County? What are we doing here? So, and you know, I should mention, Scott, that our results are good. Over the trend over years has been that underage drinking has really gone down over the past 10, 15 years, 20 years. It's had like a steady downward trend. And San Juan County Partnership is not entirely responsible for that. We can't take all the credit, but we can take some credit for it, because that's the work that we have really concentrated on doing for years.
Well, and you're tracking that, and then again you have the data, so you can remind us when the numbers are going down, and how we're doing. And I know you do a lot of marketing and promotion of some of those social norms too. That not everybody is drinking underage, and not everybody is using drugs or alcohol and things like that, which is always good to be reminded of.
We'll have two new social positive community norms messages coming out.
Okay.
Not very long from now, but we're working on those right now. We have the message. We just are working on the image and projecting it. So those new norms are around binge drinking, which has also gone down quite a bit in youth, and also on young people riding with people who have been drinking. And the
right.
percentage is really great of young people who do not ride with anybody who's been drinking.
So that message is getting through, which is good.
It is great.
Good to see. All right. We are almost out of time. So before we run out of time, I want to talk again briefly about the big show coming up October 20th. It is San Juan County's Got Talent, the 5th annual, right here at San Juan College. And it's a fundraiser for the San Juan County Partnership, helping to do a lot of things we've just been talking about in the last 20 minutes or so.
And Scott Michlin is our MC, who does
I will
an
be there.
absolutely fantastic job.
Well, thank you. Looking forward to it. I have new shiny shoes this year, so we'll see how they look.
I'm
So get ready
excited to
for that.
see them.
Yeah.
Get your cameras ready.
Get it ready, everybody. Exactly. And Debbie Frank, the tickets are available right now, you said.
Right now, you can call our office at 566-5867. Go to our website, sjcpartnership.org.
Okay.
And you can buy them at the door.
$8 for adults and $5 for children 12 and under is
Right.
the price, as we said, cheaper than a movie. So
It is.
there you are.
Bring
Perfect.
the whole family.
Bring the whole family. Cheer on your favorite. And again, our judges, our celebrity judges, again, are going to be. You've got a whole table
have-
full. Boy, we got a whole.
Yeah. Nate Duckett
Mayor Duckett.
and I just
put you on the spot.
Shane Ferrari, who is
Undersheriff.
our undersheriff currently, and Watona Vicente, who is with Office of Dene Youth in Shiprock, Tone Fetz from San Juan College.
Band director here, sure. Knows his
And-
way around a drum set.
Oh, he's amazing,
Right.
isn't he?
Yes, he is.
And I just got to meet him recently,
Oh,
so
great.
he's really great.
Yeah.
And Monica Leeming, who works for Farmington Schools, is
Another
the
great
band director
musician,
at
yes.
Farmington High School, and is a performer. So I think we have great judges. It's going to be a great time. People just really, really enjoy the show.
It's a great show, and it's a lot of work, I know, to put it all together. So kudos to all of you and others who are working behind the scenes to make this happen on October 20th. So
Right.
looking forward to it.
Thank you, Scott.
Thank you both very much. My guests from the San Juan County Partnership here on KSJE. Back with more in just a moment. The time is 8:54.